Friends, myself Dr. Prashanth, practicing ENT surgery, practicing at Prashanth Hospital, Banshankari, would like you to know something about allergic rhinitis and its management. So, allergic rhinitis is the inflammation of the nose caused by allergen triggers. So, these allergen triggers are the uh, allergic particles or proteinaceous particles which are present in and around you, which can trigger the symptoms of allergy. These symptoms most commonly are the itchy nose, running nose, sneezing, nasal block or nasal congestion, and the postnasal drip. Postnasal drip is nothing but the sensation of phlegm coming on the backside of your nose into the throat. So this especially present in persons who experience chronic allergic rhinitis. According to the duration, it can be classified into seasonal and perennial allergic rhinitis. Seasonal allergic rhinitis is the one where the allergic symptoms are predominantly seen in particular seasons. For this, the allergens most commonly responsible are the pollens. So the pollen count in the outside weather can vary depending upon the temperature and also the moisture. So they are especially common in winters and summers. So those persons who are having seasonal allergic rhinitis experience more common symptoms during this particular season, whereas they are okay during other seasons. Whereas the other variety, that is perennial allergic rhinitis patients, experience symptoms all throughout the year, where there will be waxing and waning. But most of the times the symptoms are almost present. So for this, the most common allergens responsible would be the house dust mite, cockroach dust, home danders, then the animal danders. So you know that these allergic particles are present all throughout the year in and around the home or the office where they work. So who experience this allergic rhinitis, and in which age group it is common? So it commonly represents the middle age group, that is active period of life, and also young children's. So they are more prone for this allergy. How to avoid and what prevention you can take for this to avoid symptoms? So here are a few tips. So those who are suffering from seasonal allergic rhinitis, they should keep their doors and windows shut during pollen season, especially better. Then they can use air condition to cool their home instead of fans and coolers, so which bring in outside air. And they should also consider their activities depending upon the pollen counts in the outside weather. Whenever the pollen counts are less, they can plan their outdoor activities and avoid other extremes of time. And those who are suffering from perennial allergic rhinitis, most often you know that they are caused by house dust mites. It's always better to cover their mattresses and the wash their pillows, sheets, bed sheets, blankets weekly in hot water. So these house dust mites resist lukewarm water, and it's always better to wash it with hot water once in a while. So if those persons are allergic to animal danders, then they should avoid keeping the pets in their home. So in case if it's not possible and if they have to keep the pet, then they should make sure that it should stay outdoors and doesn't let it indoors. If at all, even if they come indoors, then make sure that it should not enter into the bedroom at all times. So always some people are also experience allergic rhinitis for irritant substances, just like perfumes or smoke. So they should avoid smoking, and even the passive exposure to smoke also should be avoided. So and in case whatever possible from their side, they can help to prevent allergic symptoms. if at all, if it's not avoidable, so there are simple ways to treat, and your doctor can help you in treating this condition. A simple anti-allergic medications can be prescribed, which you need to take it for a while. So practice this in your home, and you can make sure that most of the times you can be symptomless. Thank you.